More than 1 person in 10 suffers from migraine, a complaint that can have a serious impact on daily life. Migraine, therefore, is more than just a headache. In this short film, we explain exactly what migraine is and what you can do to limit or even prevent the symptoms. Migraine is a complaint that is connected with a severe form of headache. A migraine attack often starts as a dull headache, which then develops into a throbbing or pounding pain, mostly on one side of the head. This pain can spread further to the neck and shoulders. With a migraine attack, other symptoms can also occur, such as nausea, vomiting, and a hypersensitivity to bright light, sound, and even smells. With some patients, a migraine attack begins with an aura. That is the generic term for a number of neurological symptoms, such as flashing light, hallucinations, or other sight disorders, but also sensation disorders, paralysis symptoms, or even speech disorders. The aura usually disappears shortly before the headache occurs, or sometimes it merges with it. The exact cause of migraine is still under research. We do know that migraine is a neurovascular complaint that is related to an overreaction of blood vessels in the brain. Migraine occurs more with younger people than with older people, and more with women than with men. Furthermore, the complaint is hereditary. Migraine patients often know other family members who also suffer from it. Migraine attacks can be provoked when specific factors or situations arise. Such a factor is also known as a trigger. Examples of triggers are specific types of food, drinks, or environment factors. Triggers are very individually determined and vary from patient to patient. For some migraine sufferers, alcohol, stress, or menstruation can be triggers, while for others it might be coffee, chocolate, or a certain smell. So, as a migraine sufferer, it is very important to know your own triggers. Due to the fact that each migraine patient is different, there are various ways to treat or even prevent migraine. In order to limit the seriousness, length, and frequency of migraine, a regular lifestyle is crucial. Eat, sleep, and move regularly. It is also important to avoid or limit stress. Migraine sufferers can also get to know their personal triggers and then learn to anticipate them. In addition to good hygiene, medicine can also be prescribed to treat or relieve migraine. There is acute and preventive medication. Acute medication fights the pain directly the moment it surfaces. If you have more than 2 or 3 migraine attacks per month, then preventive medication can help to limit the number of attacks and their intensity. Ask your doctor for advice. Migraine can be very painful and can seriously hinder daily activities. So never say just a headache about a migraine.